There are so many people or patients, right? Okay, immediately they have back pain. They straight away tell, oh, I think I have some slip disc. We have not been using the word slip disc for the last 10 years. Reason very simple. At the moment you have the disc that slip out, but actually at the same time, one of your muscles get cramped up. Okay, that muscle we call it multifidus. You can't get up from the bed. You cannot turn on the bed. Whenever you sit down, you have difficulty to stand up. And then when you stand up, you cannot immediately stand up straight. You're like an old man. So all these are the symptoms where you call slip disc, but actually in Benphysio, in our terminology, we call it muscle spasm. So today, when you have slip disc, don't worry. Because why? Put it aside, that is a medical terms. But what for us, what we see is you are having muscle cramp. So therefore, we will manage you from muscle cramp point of view, whereby we will help you to loosen the muscle. We will tell you what is the reason, what is the underlying root cause that causes your muscle spasm, which is the most likely is your posture and how you carry things. Okay, how you carry weights in your gym, deadlift. Okay, then we will educate you on that. And then once we can loosen your muscles and make your muscles relax, your so-called slip disc symptoms all gone away.